We're here with Dr. Voellinger from SE Bariatrics, and we are here with the Vinci Robot at Discovery Place. Dr. Voellinger, how has the robot helped you with bariatric surgery?
It allows us to do more precise movements, safer, more efficiently. The degrees of freedom, the robotic wrists are amazing. Our human wrist can only do certain movements. Robotic wrists have 7 degrees of freedom, so we can do a lot more precise movements. The other thing that's really exciting about the robot is the vision. 10 times magnification over our human eyes. Plus we have 3D vision, so we can really see things better than we ever have before. It allows us to do very precise movements in a very safe, controlled fashion.
So when you're doing bariatric surgery, do you use it to put in lap bands as well as gastric bypass?
We primarily do gastric bypasses because the gastric bypass requires a lot of sewing, a lot of tissue manipulation, where the robot is ideal for it. But we also do lap bands with it because there's a lot of sewing involved there. But primarily bypass is a little more technically advanced procedure, but certainly some lap bands and some of the other things we do, we're really excited about using for revisional surgery. For patients that have had surgery before, a lot of scar tissue, a lot more difficulty for laparoscopics or even in traditional incisional open surgery. The robot allows us to see it better, visualize that scar tissue and remove it.
Do you feel that it has, does it cut down, not just feel, but does it cut down on the time of recovery for the patients that come in for these surgical procedures?
We think so. We think it creates less pain. If you think about it, so we've gone from incisional zipper surgery, to show you there, which is obviously can be a lot of pain after the surgery, to keyhole surgery,
right.
Laparoscopics. Now the difference in robotics is we're still doing keyholes, but we're not manipulating the keyholes as much because the robot takes all that away. So there's less stress and trauma on those little bitty keyhole sites, so our patients are taking less pain medicine and recovering faster.
And has it made your life easier surgically for the hours that you spend in every day? As far as time-wise, the strain on your body, the strain on your hands and wrists?
I think that's the big thing, is the ergonomics. It's amazing. So the robot is set to our specific characteristics, where we want the chair position, where we want the arms position. The comfort level then from standing with the patient all day, lifting heavy instruments is a completely different situation. It's very light touch in a comfortable chair. After a day, you don't feel like you've been operating at all. Normally, if you operate all day, you feel like you've been beaten up and run a marathon. So it's a lot different in terms of our stress and strain on our bodies.
Thank you very much.
Sure.
Okay, again, this is Dr. Voellinger from SE Bariatrics, and he will be your man to take care of all your needs. Thank you.